So today, the name of my talk today is How Did I Get Here? Alcohol Use Disorders After Gastric Bypass Surgery. So I am a College of Worcester graduate. I graduated in 1999 and I have a degree in German, both foreign languages. And for the last 10 years I've been a nurse, and for the last 5 of those years I've been a nurse at the University of Minnesota Transplant Center in abdominal solid organ transplant, which is livers, kidneys, intestines, pancreas, that kind of thing. 2 years ago I decided to go back to school and obtain my master's, and I obtained my master's in addictions counseling at the Hazelton Graduate School of Addiction Studies after my own 15-year battle with alcohol addiction, and now I'm reaping the benefits of recovery. So I love this idea of push today. I'm going to push your knowledge of addiction, and I also want to push out some stigma that we carry around addiction. So I got interested in this topic when I was doing my internships, and I would sit down in the group setting and ask people, well, tell me what brought you into treatment. And it would never fail. I'd always have 1 to 3 people in any given group, male or female, that had a history of gastric bypass surgery. And they would tell me that they didn't have a problem before gastric bypass surgery, and now a couple of years later, they're sitting with me in treatment. And their question to me is, how did I get here? And it's a certainly legitimate question. So today we're going to talk a little bit about addiction as a brain disease. We're going to talk about Roux-en-Y gastric bypass surgery. There's several interventions for gastric bypass these days, but this one seems to be the most problematic as far as developing alcoholism after the surgery. Then we're going to discuss this alcohol use disorders after gastric bypass surgery. Why do we think that is? So this is the policy statement from the American Association of Addiction Medicine, also known in our field as ASAM. This is the short definition. It's not the entire definition. There's also a long definition. So if you're interested in learning more about addiction, I highly recommend that you Google ASAM, and there's a ton of wonderful information on there about addiction. But we in the field, we believe that drug addiction is a chronic brain disease. It's a disease of the brain reward system, the motivation system, and memory systems. And dysfunction in these circuits manifest in certain characteristic ways, biologically, physiologically, and spiritually. And how this plays out, if anybody's ever had any experience with addiction, is the individual pathologically seeking a psychoactive substance for reward or relief. So the question is, what does this really mean? So one of our highest priorities when people come in for addiction treatment is to actually educate them about what addiction is, what's going on in their brain. So we focus in on this old part of the brain, this very primitive part of the brain, and it is hardwired for our success and survival. So we are rewarded, motivated to do things that promote our success. So in some individuals, this portion of the brain is very, very highly agitated by psychoactive substances. And so people who form addiction tend to get a bit of a different high off of drugs and alcohol than the normal population. So it promotes this continued use by the brain. And as this use continues on, the chemicals actually alter the brain in such a way that the brain is convinced now that this psychoactive substance is required for survival. And so the stop mechanism in the brain is gone. The message is no longer there for an individual to stop actually using the substance, regardless of the consequences. So if people stop using their psychoactive substance, they start to become very, very anxious and panicked because the brain is sending them a message that they are actually dying. So the message is, do not stop, you cannot stop, and thus the cycle of addiction starts. So just a couple of quick statistics on addiction. The addiction costs the American economy $600 billion per year. 41 billion of that is related to health costs. 1 in 7 Americans are actually diagnosed with addiction. It's 40 million Americans, and 1 in 10 of those individuals will actually get the treatment that they need. So moving on to the gastric bypass portion, what happens with gastric bypass is the surgeons go in and they create a new stomach. And it creates a new small pouch And the gastric enzymes and gastric juices in the stomach are still doing what they're supposed to be doing as far as aiding digestion. So that is reconnected down in the lower part in the intestine, and then the intestine is then attached to this new pouch. And what that does is it prevents people from being able to eat large quantities of food at one time, because if you can see from the picture here, the pouch is pretty small. And then it also inhibits the amount of calories that someone can absorb while they're eating food. And the benefit then becomes very, very rapid weight loss. So why would we consider gastric bypass as a pretty extreme when you look at it and from a surgical standpoint? But 78.6 million Americans are obese, and that's 1/3 of the population. And that obesity is considered with a BMI of 40 or greater. So just for a reference point, if you're 5'5" and weigh 240 pounds, you have about a BMI of 40. And so the comorbidities, I probably don't have to spend a lot of time on this. If you watch the news, you probably heard a lot about it. There's increased risk for heart disease. There's also increased risk for diabetes and several complications that come from diabetes. There's also an increased risk for certain cancers. And then in the transplant arena, we do have individuals that come in that are suffering from fatty liver disease, where the liver actually is infiltrated with so much fat that the liver can no longer function appropriately. And that's called NASH, or fatty liver disease. And the longer, in the chronic stages of that disease, a transplant is actually required for survival. Obesity costs the American economy about $147 billion per year and is the #1 preventable death in the United States. So anecdotally, we were hearing from our clients for a while now that they didn't have this problem with alcohol before their gastric bypass surgery. And the research is actually relatively new, but the concept of an increased risk for alcoholism after gastric bypass isn't. So the first study, major study that was done was from the National Institute of Health, and this was published in the American Journal of American Medicine, in 2012. So there was over 1,900 participants in this group, and 70% of those individuals had gastric bypass surgery, the Roux-en-Y gastric bypass surgery that we're talking about today. And of those individuals, 7% had alcohol use disorder prior to surgery. So they followed up with these individuals throughout the years, and at the post-op year 1, they didn't see a change. That figure stuck right around 7. Now it was at year 2 that all of a sudden that rate jumped to 10.7% now had alcohol use disorders. And so that's about a 50% increase. So that was pretty eye-opening. So a second study that was completed is the Swedish obese subject study in 2013. And so this had a little over 2,000 participants in it, and there was actually also a control group. And so the control group in this study, over a period of time, 96% of those individuals would not be considered at risk for alcohol use disorder. Meanwhile, the gastric bypass group was at 93.1% of being considered low risk for alcohol use disorder. So it was definitely noted that there was a difference there between the control group and the gastric bypass group. And basically the conclusion was that there's an increased risk and we should use alcohol cautiously. So the question becomes, why is there this extra risk after gastric bypass surgery of developing alcoholism? So first we're going to take a look at the psychosocial profile of an individual that's seeking gastric bypass surgery. The rates of depression are astronomical. 50% of individuals have been diagnosed with depression. We also see individuals that are suffering from PTSD or post-traumatic stress disorder, agoraphobia, which is an inability to go out into the community. We also see high instances of bulimia nervosa, which is binge eating. And then we also have self-reports of lots of issues with body image and self-consciousness. And also there's a lot of societal rejection and social isolation that comes along with obesity at times. So these factors right here are some of the factors that we see in the general addiction population anyway. They're issues that make an individual more susceptible to developing addiction in order to cope with some of these issues. Now the last 2 points on this particular slide deal with a little bit more of why we think it happens at the second year that all of a sudden that alcoholism rate increases. So anytime we make a major decision to do something in life, we have expectations. And regardless of the the amount of education that we get or we hear personal stories, we have an expectation in our mind. Now, 40% of individuals who get gastric bypass surgery have complications. And that can be infections, that can be wound healing issues, but there's also some gastrointestinal side effects of gastric bypass surgery that are kind of unpleasant. And now that is going to be a life issue that they're going to have to deal with. So the idea is that their expectations haven't been met. So they go into this surgery and the weight loss is definitely there, but the rest of their life didn't change. The surgery didn't change everything that I wanted it to. And now, on top of that, we've added some pretty big complications to the story. And it seems kind of likely to me that they might be seeking out a way to cope. All right, and then the second one is actually pretty interesting to me. So I had a lot of my clients complain to me that they felt like they were more sensitive to alcohol. And there was a small-scale study done, and 1 in 5 individuals who had gastric bypass surgery did report that they were more sensitive to alcohol, and they're probably right. So the first spot of breakdown for alcohol is in the stomach. There's an enzyme called alcohol dehydrogenase that immediately starts to break down alcohol in the stomach. Well, if you remember from our picture, we took that part of the stomach out now. And so that enzyme doesn't have its job anymore in the stomach, which leads to the alcohol being absorbed right into the intestine. So they did a small study with a control group and the gastric bypass group, and yay, everybody got 5 ounces of wine just for participating. So the gastric bypass group, their blood alcohol content peaked at 0.08%, which I need to remind anybody is the legal driving limit here. And it took on average 108 minutes for the alcohol to be excreted out of the system, so a blood breathalyzer would read 0. Now the control group, on the other hand, same amount of wine, peaked at 0.05%, and it took on average 72 minutes to get out of the system. So this as an isolated issue for this increase in alcoholism could be because we're looking at quicker physical dependence. People get drunker, faster, for longer. So that can certainly be problematic in the area of developing addiction. And lastly, we're going to look at this concept called cross-addiction or addiction transfer. So when my clients come into me and I start talking to them about issues with addiction, cross-addiction is a concept that we see happening fairly regularly. So someone has a drug of choice, their primary drug that they're having an issue with, and we take that away from them, of course, in treatment. And what we can see it happening at times is that addiction behavior popping up elsewhere in their lives. So we haven't done a very good job then of treating the primary addiction if those addiction behaviors are coming out elsewhere. I've seen people who give up alcohol that begin to gamble excessively. I'll see people coming off of cocaine that turn to benzodiazepines. I've got people that are coming off of methamphetamines and choose to smoke marijuana. So it's basically transferring all of the bad behavior from one addiction to the other. So the discussion with this is food addiction. And it is not always widely accepted that food is addicting. However, for the purpose of this talk today, we're going to assume it exists. The MRI imaging and research is now showing that some high sugar, high fat foods actually have the same effect on the brain that cocaine does. Cocaine is a highly addictive substance. So in this concept, we're looking at food addiction being present prior to the gastric bypass surgery, and it was undiagnosed or not treated. And now, with this gastric bypass surgery, we took away their ability to binge eat. And so they no longer have their coping mechanism that they had prior to surgery. So what we think happens is that alcohol ends up popping up then as this addiction transfer, and then from the previous slide, they get drunker, faster, for longer. That seems like a really good connection if that's what you're seeking. So in conclusion here today, I don't think there's really any smoking gun, one specific reason why this happens, but based on the psychosocial profile and this altered alcohol metabolism, and then also maybe untreated addiction, are some of the things that we see in the general addiction population, especially in the area of undertreated mental health. Individuals tend to gravitate towards substance as a way to deal and cope with their problems, and if it isn't treated in the correct fashion, really some problematic behaviors start to come up. So prevention is probably the strongest tool that we have in addiction, just to try to prevent addiction from setting in. Addiction is very, very difficult to treat. It takes on average 5 times the treatment before folks are able to maintain some level of sobriety. So the pre-operative screening used to say, please don't drink alcohol for 6 months, let your body heal, that kind of stuff. And now with the research that's starting to come out indicating, whoops, we might have an issue here with developing alcoholism after the fact, now they're saying, please don't drink for a year, maybe 2 years. But from a dietary standpoint, and also from an addiction standpoint, alcohol doesn't serve any purpose, really. Nutritionally, it's just high calories and doesn't have any nutritional benefit. Meanwhile, it inhibits weight loss. So now I think the recommendations are starting to come out that if you don't need to drink alcohol, please don't. So I want to thank everybody for your time and attention today. It's been a blast.